Hello, hello. Good morning, good afternoon, or good evening, depending on what time you're watching this on demand. Medicare 101 refresher presented by Troxel and Grinning Health and Wealth. We are Grinning Health and Wealth, Troxel's trusted partner for Medicare and retirement advisory. So, looking forward to presenting this to you. And this is for two people. Maybe you're turning 65, going on to Medicare for the first time, okay? Or maybe you're already on Medicare and just need a quick refresher and need to review your plan. Whatever it is, we're here for you, and we'll get you refreshed or educated on your Medicare options. So just real quick, my name is Chase Gruening. You can see my family. There's my wife, Emily, my daughter, Remy, my dog, Rip, and my newest daughter, Hunter. These gals are my world, and couldn't do without them. My wife is actually our COO and works with us, so you may see or talk to her on the phone as well. So I'm the founder of Grinning Health and Wealth. We are a mid-sized agency. We've got an office in Springfield, Illinois. You'll see in just a second. Couple offices in Tennessee, and we're licensed in all 50 states. I'm a Medicare and retirement expert. Been doing it for about 10 years now. You can see in the bottom right, the Medicare breakdown book, the book I wrote, and you can stop by our Springfield office and pick up a copy if you'd like, or we can send you a digital one at any time. Also, I was a coach for many, many years. I coached high school and college football, notably at Williamsville High School in Central Illinois, and then at Northern Illinois in the Chicago area, suburb area. And I got out of coaching, went into Medicare and retirement planning, and that's where I found my lane. That's where I've loved, enjoyed educating and teaching ever since. A little bit about our agency. We now have over 300 five-star reviews. We do in-person and digital learning. You can find us on Google, and there's a picture of our Springfield location. We're at 1124 Century West Drive, or Center West Drive, excuse me, right by PNC Bank, Springfield Clinic, and right off Monroe and Old Jack. So come by and see us anytime. You can also find us on Facebook, Instagram, all the social media platforms, and our goal is to treat you like family. Picture there is my mother and father-in-law. They're over 65. They actually live in California full-time, or part-time, I should say, and I'm excited to share with you how we have treated our own family and hope to do the same for you. So we're going to get right into this thing with original Medicare. This is where Medicare began. So no matter what, when you go on to Medicare, you're going to have an option to go on to original Medicare. Okay, original Medicare is Part A and Part B. So this is the foundation. This is where it all began. So if you're taking notes, and I urge you, okay, to pause if you need to, grab a piece of paper, and let's start taking notes together. Okay, Part A, if you want to write that down, is hospital coverage. Part B is doctor coverage. So when you think about inpatient admission, you're staying overnight in the hospital, that's going to be Part A on your Medicare. Part B is going to be doctor or outpatient coverage. That all falls under Part B. Part A is traditionally a zero premium. Okay, we paid into it for our taxes all these years. And if you work 40 quarters or you have a spouse that worked 40 quarters, typically you don't pay anything for it. So that's a great addition right there. Let me get my chair out. Part B, $174.70 a month. So that's the standard Part B premium. So no matter what, not no matter what, but most of the time, you're going to pay at least $174.70 unless you fall into a special scenario where you pay less or more for the Part B premium. But $174.70 in 2024 is the standard Part B premium. Now, let's talk enrollment scenarios. So I want you to identify which one you fall under here. Okay, if you're 64, turning 65, going on to Medicare, you definitely want to identify one of these things. If you're already on Medicare, okay, this may not apply to you as much, but it's a good refresher. Okay, scenario one, you're currently receiving Social Security benefits. In this scenario, you're 64, you're already receiving Social Security benefits, you're automatically going to be enrolled into Medicare. Okay, so we'll identify this down the road. Scenario two, you are not receiving Social Security benefits. In scenario three, you're still covered under an employer plan. So identify which scenario you fall under here. Scenario one, you're currently drawing Social Security benefits. Well, if this is the case, you're automatically going to be enrolled into Medicare when you turn 65, unless you choose to delay Medicare. Okay. Again, there's that $174.70, and you're going to get your Medicare card about 3 months before you turn 65. Scenario two, you're not drawing Social Security benefits. Okay, so this could be somebody that's turning 64 or somebody that's over 65 that's getting ready to go on to Medicare. Well, in this scenario, you have to manually enroll into Medicare. Okay? And you can do this a couple different ways. Online at ssa.gov, over the phone, in person, or by mailing. we have a nice, really short video that helps walk you through how to enroll into Medicare online. Super easy, and we'll walk alongside you with this deal. If you want us to get on the phone with you, help you enroll in this is something we can hold your hand and assist the whole way through over any of these channels, and we're happy to help. Scenario 3, you're still working and covered under your employer plan. Okay, if you're still working and covered under your employer plan, well, I have a recommendation for you, and that is compare your options with Medicare. So often I see people overpaying for group coverage when they have the option to go onto Medicare and save money. Okay, and it's just a simple review, simple phone call where we put your group insurance on one side, your Medicare options on the other side, put them side by side, and we compare which one is best for you. So we're happy to walk you through that process as well. Okay, one little reminder I want to make sure you are aware of. If you have a birthday that is on the first day of the month, so if you turn 65, for example, on September 1st of 2024, well, your Medicare is actually going to begin 1 month early. So if I were to simplify that, if your birthday's on the first day of the month, then typically your Medicare is going to start 1 month earlier. Weird rule, don't know why. I want to make sure you know about that. Okay, again, we're going to go back to the foundation of Medicare, parts A and B, and talk about the major exposures. So if I just keep that red, white, and blue card and do nothing else, okay, Medicare, red, white, and blue, A and B, and I do nothing else, well, I take on some major exposures, okay, and that's why we're having this conversation here, is do you want to take on those major exposures, and how do I cover up those major exposures, okay? Remember, Part A is going to be hospital, Part B is going to be doctor. Now, Part A exposures. Right off the bat, if I'm admitted to a hospital, I have a $1,600 deductible. Part B now, I have a deductible of $240, and I have this co-insurance of 20% with no limit. So let's just use a nice round number of $100,000. If I have a $100,000 doctor bill and I don't have anything else besides Medicare, well, I've got a 20% co-insurance, $20,000. And that Part A deductible is $1,600. That's just for day one. If you have a longer stay, you could have a daily copay that could add up to thousands of dollars. And most of the plans that are available are going to cover the majority, if not all, of this exposure. That's what we're going to be talking about. So what covers these exposures? Well, you guessed it, Medicare Supplement and Medicare Advantage plans. That's what we're going to be spending the next 20 minutes or so talking about, and making sure you're up to date, knowledgeable, and make sure you have the best one of these for you. So let's start off by comparing them side by side. Original Medicare here, okay? You got original Medicare, that's A and B. Typically, you're going to add a Medicare Supplement and a Part D prescription plan. That makes up the comprehensive Cadillac plan that is original Medicare. Okay? Medicare Advantage, your other choice over here, also known as Part C. Well, that combines Part A and B and prescription drug coverage, typically, all into one plan. Okay? We're going to break this down even further here coming up. So if I'm you right now, I'm drawing a line down the middle of the paper, and I'm writing Medicare Supplement on one side, Medicare Advantage on the other side. Now, let's do a deep dive into Medicare supplements. So Medicare supplements, the price, okay? No matter what, you've got to pay that Part B premium. If you go Medicare Supplement or Medicare Advantage, you got to pay Part B premium. $174.70 is the standard, okay? So expect at least that amount. The coverage, now that's going to be the most robust coverage if you choose a Medicare supplement. You're going to have the lowest out-of-pocket cost. You're going to have the most comprehensive coverage. Networks are going to be able to choose any doctor you want in the entire United States as long as they take Medicare. No referral needed. Okay. Part D, now we have to choose a separate Part D prescription plan to go along with that Medicare supplement. Now, Medicare Advantage. Again, that $174.70, we can't get away from that sucker. Okay. Coverage now, you're going to have higher out-of-pocket costs, and you're going to have networks. So with the Medicare supplements, and we'll put them side by side, it's kind of the option, if you will. Higher out-of-pocket cost. You got to see specific doctors and hospitals that are in the plan. In other words, a network. Now, the nice part is a Part D plan comes with this plan. However, you don't get to choose the Part D plan. It's just whatever comes with that plan. And they have these extra benefits that include dental, vision, gym, over-the-counter benefits. See a lot of that stuff on TV. It's very attractive nowadays. Now we put them side by side, and if I were in an elevator with you and I had 1 minute to explain these two, here's how I'd explain it. Medicare supplements, you pay more, they cover more, you have very little out-of-pocket expenses, you can go to whoever you want, okay, and you need a prescription drug plan. Medicare Advantage now, you pay less, you take on more exposure, They bundle in these extra benefits, but if you have a bad health year, you may end up paying more than if you just chose the Medicare supplement. See how easy that was? Okay, that's how we summarize it there. Obviously, there's a lot more to it, but when you break it down in the simplest form, that's it. Now, whichever route you go, it's extremely important you know. Cancer, heart attack, stroke coverage, we always recommend it no matter which route you go. If you have a cancer, heart attack, or stroke, you're going to have out-of-pocket expenses beyond what Medicare covers. It's extremely important you have what we call a critical illness plan in place. Now, one of the most, if not the most important part of Medicare is understanding how they pay for skilled care, nursing home coverage, and assisted living. Okay? Medicare, A and B, pays for days 1 through 20. You have to have a 3-day hospital stay for that to happen. Your Medicare supplement will pay for up to 80 additional days. So the most possible coverage, if you look at that third bullet point, the most possible coverage you can have is 100 days. After 100 days, you are completely on your own. Okay, the biggest exposure we see and the most overlooked coverage we see. So it's very important you know how skilled nursing coverage works and doesn't work with Medicare. Okay, and I'm going to go to this next page here. This is right out of your Medicare handbook, page 28, and it says right there, skilled nursing facility care at the bottom. Medicare only covers skilled nursing facility care after a 3-day minimum hospital inpatient stay. So you have to have a 3-day stay for it to do anything. And then after that, okay, 100 days max, then you're on your own. How do we take care of all these exposures we just talked about? Well, it's very simple. We have the umbrella coverage options. Umbrella 3, 2, or 1, okay? Always recommend umbrella 3 if it's in the budget, if it makes sense for you, if you qualify for it. A lot of these things, for example, the recovery care, the home care, the critical illness, you have to be able to qualify for that. You have to be able to pass underwriting. Okay, if you're able to pass underwriting, we recommend umbrella 3 that has the critical illness, the dental vision hearing, and the home care, recovery care, assisted living, or short-term care, we call it, bundled into that umbrella 3. Umbrella 2 scales it back a little bit, critical illness plus the dental vision hearing, and a bare minimum, we have the critical illness with your Medicare plan. Okay, so one of those, and obviously the 3. Umbrella 3 is what we recommend, but just having some type of umbrella coverage to cover those major exposures. So let's take a deep dive into option 1 Medicare supplement. So as I'm talking here, if you feel like Medicare supplement, you're leaning that way, you're resonating that way, this is really what we're going to focus in on, that Medicare supplement, and really get to know what a Medicare supplement is. Okay. So again, we got these major exposures, Part A, Part B. How do we cover them up? Well, Medicare supplement is really going to comprehensively cover these things up. So let's focus in here on Medicare supplements. This is also from your Medicare and new handbook. This is the Medicare supplement or Medigap. Medicare supplements are also known as Medigap. This is the chart of Medicare supplements available to you. So you have the A through N here. Don't know why they letter it this way, but I will tell you this. Plan F, G, and N are really the only plans we ever see. Okay. Plan F is the most comprehensive, but fun fact, if you turn 65 after January 1st of 2020, then you are not eligible to choose the Plan F. Okay, your only options, your really only common options are going to be the G and the N. Okay, if you're on Medicare before 2020, we can still get to that Plan F, but the Plan G is going to be the most comprehensive option for everyone. Okay, and you go down there, you see 100% coverage. The only thing it doesn't cover is the Part B deductible, which is that $240 per year. After $240 per year, all your Medicare approved expenses are taken care of. Plan N, you can see the same Part B deductible you're responsible for. Now, the difference here is you're also responsible for those Part B excess charges. Now, Chase, what are excess charges? Well, the simplest way I can explain that is you could have a small copay of $20 when seeing a physician or $50 when going to the emergency room. Then you have what's called this excess charge, which could be if the doctor charged over the Medicare approved amount, it's called an excess charge, which could be up to 15% over the Medicare approved amount. It's very minimal in the grand picture. Very rarely do we see it, but it is possible, and we do need to talk about it. Again, skilled nursing coverage. Even if you have that Medicare supplement, I know we talked about how comprehensive it is. Well, where Medicare, again, lacks so much coverage, and the most important thing we need to know is that skilled nursing home coverage. And up after that 100-day mark, you're on your own. So we need to make sure we have that coverage in place. That's in your umbrella 3, and we can even put it in an umbrella 2 and flip-flops and things if we need to. Now, Chase, the most common question I get is, what is the cost of Plan G? Well, I'll tell you right now, I'll give you an average. It's all based on that zip code. So if you hear us asking for your zip code, that is why. Okay, $100 to $200 Central Illinois. We're really right at the low end of that $100 range. So turning 65, you're in that $100, $125 range. If you're in that 75, 80-year-old range, well, you may be closer to 200, but we're right in that average there, which is nice to see because it's not that way throughout the United States. Okay, which Medicare supplement plan is best for me? Well, I would answer that question by saying it's all a matter of preference. Okay, I know that's the easy answer, but it really is. I mean, when it comes down to budget, it's like a $30 difference a month. The plan in could be $20, $30 cheaper a month, but you take on maybe that possible excess charge of 15%, some copays. So Plan G is really the comprehensive option, but we can take that plan in savings and put it towards that umbrella plan. So some people like that as well, but there's no wrong answer there. Okay. Key points about Medicare supplements. When's the best time to enroll? Well, if you're going on a Medicare for the first time, 6 months prior to your 65th birthday month, or a couple months before you're turning 65. That's where you're going to get the cheapest rates, avoid mistakes, check it off your list. Okay. Remember, these are standardized plans, so they're federally regulated. Coverage follows the letter, not the company. So, for example, we see a lot of Blue Cross, we see a lot of Aetna, Mutual of Omaha, Cigna, you name it, all these different companies. Well, they're all offering the exact same coverage. The only difference is the price. So by federal law, no company can offer you a different Plan G. So for example, right now, if you have a high cost or your premiums keep going up, 9 times out of 10, you can save a boatload of money and have the exact same or better coverage. And it's extremely important you review that plan if you currently have one. Here's our list of Medicare supplement companies. This isn't even all of them. There's a ton of them. And my main point in putting this up here is we represent just about anybody and everyone. We have no bias here. We just want to make sure you're not overpaying for your coverage. Just like home and auto insurance, there's no point in overpaying for that stuff. And that's what we're going to make sure with your Medicare supplements. You're not overpaying for that. As we keep cruising along here, I'm going to bust some myths for you real quick. Myth number 1, I must have to pay a fee to use a broker and get help with all this. Completely not true. We charge you no fees of any kind for our services. Myth number 2, nobody works for free. You're right, they do not work for free, but the insurance companies pay us. So no matter which one you choose, they're going to pay us. And the power of being a broker is, again, they're paying for us to provide their product rather than you. So you could go to these companies, pay the exact same price, but it's going to be a heck of a lot harder for you to navigate all this stuff, and we're here for you 24/7, 365. Myth number 3, if you get paid by the insurance company, it's going to have a bias. Again, every company is going to pay us. Our goal is to save you the most money as possible, and you are not going to pay a single penny more if you do this on your own. Or a single penny less, I should say, if you do this on your own. To wrap it up, the 3 truths about using a broker: no fees. The price you pay the insurance company is the same with or without a broker. We represent over 25 companies and don't have a bias towards one over the other. Prescription drug coverage. I'm going to zoom through this, and I know a lot of you probably already think I'm talking super fast, but I'm going to really get through this puppy because in 2025, prescription drug coverage is completely changing. And when I say that, prescription drug coverage in 2025 is changing for the better for the consumer. They're getting rid of the donut hole. There's going to be a cap on the amount that you can pay out of pocket. It's going to benefit you so much, especially if you're taking heavy-duty prescriptions. But the reason I expedite this part of the presentation is because Medicare prescription drug coverage is so individualized. I have people that have no prescriptions. I have people that have 15 prescriptions. And there's a completely different conversation to be had with both of those potential prescription drug plans. And my point being with that is we have a process for each person that walks through our prescription drug coverage needs. And that process is going to come down to, we're going to input your specific medications. And before I get to that, if you don't enroll in a prescription plan, you will be penalized down the road if you decide on one. So long story short, I can do a bunch of different formulas, but if you don't take a prescription drug plan when you're first eligible and you want one a couple of years later, well, they're going to go back and penalize you for the amount of time you didn't have one. So you don't want to avoid a penalty. You can find usually a pretty cheap prescription drug plan just to have one. But our Part D process, number 1, we're going to input your specific drug. So I just did a drug plan moments ago before we did this live webinar here. And the first thing I did is I input the drugs, the prescriptions, into Medicare's online calculator. I chose their preferred formula, chose their preferred pharmacy. and then compared all the different options available in that client's zip code. That client was in Florida, a lot of different options. We looked at every single one, and we enrolled them in the plan of their choice, and we're going to reevaluate that every year during Medicare's annual enrollment period, which is October 15th through December 7th. Okay, so to summarize everything, option one, you've got original Medicare, your red, white, and blue card, you've got your Medicare supplement and your prescription plan with your umbrella, and you're ready to rock and roll. Okay, let's get into option two, Medicare Advantage. Medicare Advantage, again, is a more individualized conversation. And the reason I say that is because all these plans are different. It's not like Medicare supplements where they're all federally standardized, they're all the same. Every company has a different plan, and there's only certain plans available in your zip code. So I really got to go to work for you on this one. And we're going to take into account a lot of different factors. But if we were to just educate you again on a short educational process on a Medicare Advantage plan, it's a managed care plan. Chase, what does that even mean? Well, I'm glad you asked. Okay, a managed care plan is a privatized insurance plan. For example, Medicare is actually handing you off to the private insurance company, and they're saying, hey, private insurance company, take care of Mrs. Jones. Okay, and Medicare is now going to pay that private insurance company a monthly stipend. That private insurance company is essentially going to give you an outline of coverage. Now, that outline of coverage in a Medicare Advantage scenario has to include the same basic benefits of Part A and B, but after that, they can really do whatever they want within that coverage. And I don't mean that to scare you. We have thousands of clients on Medicare Advantage. It's just an individualized plan. We really have to take a deeper look at your specific needs. Okay. Almost all these plans that we would recommend are going to include prescription drug coverage. And a lot of these plans are zero premium. But again, you still have to pay that $174.70 Part B premium we've talked about. Now, coverage, again, you're going to have copays, you're going to have deductibles, you're going to have coinsurance, max out-of-pockets. You're going to have a lot of different out-of-pocket possible expenses throughout the year. So again, if you have an unfortunate health year, it could get expensive. On the flip side, if you're a healthy individual and you don't go to the doctor much, you could save a bunch of money with this plan. You're also going to get that over-the-counter, dental, all those types of things. Cannot say it enough. We do never recommend a Medicare Advantage plan without the umbrella coverage that we talked about earlier, and we'll show one more time here in a moment. So choosing a Medicare Advantage plan, how do I do it? Zip code. There's that darn zip code again. It means so much. Okay, so we need that zip code. That's going to show us the plans available. But then we've got doctors, hospitals, medications. We're really going to hone in on those doctors, hospitals, medications. And that's really going to narrow the plans down quite a bit for us off the bat. And what extra benefits are important to you? Gym, dental, vision, over the counter. If those are important to you, we need to find out which plans cater to those needs that you have and those extra benefit areas. When is the best time to sign up for this, Chase? Well, if you're turning 65 or you're going on to Medicare for the first time, it's going to be 3 months before you go on to Medicare or turn 65. Okay, pretty simple there. Other than that, if you're already on Medicare and you have a supplement, or you're already on Medicare and you have a Medicare Advantage plan, well, the only time of the year, typically, unless you have a special enrollment period, it's going to be October 15th to December 7th. That's where I become one of the busiest mans on the planet, become very popular. That's where we make our changes. That's where we review plans for the next year. We always review all of our clients' plans during that time. Okay, just to put everything side by side again for one last time, we got Medicare supplements on one side, Medicare Advantage plan on the other side. There is no wrong answer here. Okay, it's all about what is best for you. And a lot of times I see people go Medicare supplements. Down the road, they want Medicare Advantage just to start off with the comprehensive option. You can always slide the Medicare Advantage down the road. On the flip side, if you start with Medicare Advantage and want to go to Medicare supplement, there could be underwriting. Okay, a lot of different factors to be involved with, and that's why we do a client needs assessment on every single one of our calls. And that's really going to help us understand you and your needs and make a proper recommendation for you. Okay, sometimes I do have a recommendation. If you're extremely unhealthy or have a lot of health issues, well, we're going to say, hey, Medicare supplement, that's going to cover it all. Okay, wham, bam, thank you, ma'am. You're going to be in good shape. Medicare Advantage, you don't take many medications, don't go to the doctor often, definitely going to open the option there. Can't say it enough. Whichever way you go, we need that umbrella coverage in place. 3, 2, or 1. Take a screenshot, take a picture of this, write it down, whichever one is really resonating with you, and we'll make sure we identify that and go over it. Getting close to wrapping this thing up, one last thing we want to go over is retirement and protecting your money. Okay, With a lot of healthcare transitions, we see a lot of financial transitions. And with that being said, we're going to see a lot of people that have a 401k, a SEP, a Roth, a 403b, market-driven accounts, you name it, we see it all. And what we specialize in is safe money retirement. And when I say safe money retirement, that doesn't mean you can't make any money. That doesn't mean it's just sitting there doing nothing. What it means is your principal is 100% protected from downside market risk. We still have growth opportunities, 100% guaranteed growth or indexes with a larger growth potential. Okay. Lastly, we can create pension-like incomes, Social Security-like incomes, lifetime incomes that are guaranteed for as long as you live. So we have a lot of different options in the safe money arena as well, and can continue to grow and protect your money. So make sure you ask about that if that's something you need help with. So to wrap this thing up, we have our three-phase approach, and guess what? Number one, you can cross it off. We just went over our online content here. We also offer an educational in-person seminar every week at our Springfield, Illinois location. Make sure to call if you'd like that option. We got a free copy of the Medicare breakdown book. You can get that in person, okay? Or we can send you one via email, a digital copy. Phase 2, schedule that free consultation. So if you're already on Medicare, review your plan. I cannot say it enough. 9 times out of 10, we're able to save you money or find you better coverage, or make sure that your coverage is working as efficiently, as optimal for you as possible. Okay. Phase number 3, well, that's you just sit back, relax, and enjoy the free lifetime billing and claim service from our awesome administrative team. So again, free lifetime billing, claim service, free annual reviews with your licensed agent, making sure every single year you have the right plan for you. So to wrap all that up, again, we're locking in on phase 2 here. You're going to see a blue calendar below. On that blue calendar, okay, you're going to pick a date and time. Just going to be a quick call and answer your unique questions. It's going to be with myself or Wes Lunt. Wes Lunt is kind of the liaison between us and Troxel. Okay, my right-hand man. He's an awesome, awesome human. He actually, many of you probably know, played at the University of Illinois and is a Rochester alum, and is right there in Springfield. So make sure, click that blue calendar below, book your appointment, and we'll see you soon. Reviewing your plan, turning 65. We've got all your questions covered. And lastly, appreciate your time so much. We got about 28 minutes here that we went through this, and I know everybody's time is important, and just appreciate you spending 28 minutes with us. So hopefully you have a great day, great week, and we'll talk or see you soon.